Frail elders often have multiple chronic illnesses that are apt to require trips to the hospital, and sometimes multiple trips to the hospital over the course of a single year. In fact, more than 40% of adult patients in acute care hospital beds are aged 65 or older. Amy O'Rourke with the Cameron Group has some practical tips for managing an elder's care in the hospital. Welcome, Amy.
Thank you. Glad to be here.
Now tell me, what does a typical elder patient in the hospital look like?
It looks like a woman. Oftentimes they're female. We outlive the men. And they're sitting in the emergency room lying on a gurney. And the hospital oftentimes will make the assumption that they've come from the nursing home.
Okay, now I imagine that the emergency room setting can be really unsettling for an individual.
It's unsettling and it's harsh and it's frustrating, too much light, too much noise, too much overstimulation. And in and of itself, the emergency room can be devastating to an older person. The more hours, the greater risk of a decline just in the emergency room.
All right, how do you get around going to the emergency room?
Well, my first thing I tell families is to stop, and if someone's saying you need to go to the emergency room, stop and ask, do I really need to go? A typical scenario is a resident in a nursing home has fallen, and the nursing home automatically wants to send them to the hospital. That's not always necessary, and oftentimes families don't know that they can say no. Can an x-ray be done in the nursing home? Can something be done in the nursing home? Is there any way to avoid having to go out to the hospital in the first place?
Now, if a patient is given a bed in the hospital, does that mean they've been admitted to the hospital?
No, that is such a great question. Right now, hospitals are not always admitting an older person to the hospital. They can be granted time there under what's called observation status. And if that's the case, and they need rehabilitation in a nursing center, they won't get Medicare coverage if that time is classified observation. So an important question for a family member to ask is, has my parent been admitted to the hospital, or are they here under observation status?
All right, so observation as opposed to admitted, you need to get clarification for that. Now, what about the transfer of medical records and medication?
Okay. Don't assume that if your loved one goes to the hospital, that if they're on their medicine, that they will get that same medicine in the same time frame at the hospital. I think the most conservative thing is to assume they're not going to get the medication, and to make sure that particularly in the psychiatric mental health area that some way or somebody's overseeing that issue.
Now, I know usually a number of tests are ordered. Can you refuse the test?
Yes, I love this question. I love this question. If the hospital wants to run a bunch of tests, there again, you stop and say, am I going to do the procedure at the result of, if the procedures show you need to have surgery? If you're not going to do the surgery, turn down the tests. I guess my point would be to manage your own decisions yourself, because the hospital will only do the most conservative action, which is more tests, more procedures, more surgeries, because that's how they're built and that's how they get paid.
So you need to ask questions.
Absolutely.
Now, we're ready for discharge. How does that go?
Okay, it doesn't go very well.
Not that
it doesn't go very well, no. At 4 o'clock in the afternoon, typically 5 o'clock in the afternoon, the hospital's in a hurry to have you discharged. The most important tip is to say, stop, appeal the discharge if you think there might be a problem or that the discharge is not appropriate, and you can appeal the discharge and buy yourself at least 24 hours.
Wonderful.
Yeah.
Amy, I really do appreciate you giving us these tips. That has been very helpful. But I think we also need to remember that it's a team effort with the doctor, the patient, and the hospital. Thank you, Amy.
You're welcome.
Well, Amy O'Rourke has given us some very practical tips for managing an elder's care in a hospital setting.